So you need to bring inflammation down. First thing we do always, we look at what person eats. Because with food, we can bring a lot of inflammation down. But when they're severely inflamed, food is not something that's going to give a really quick and drastic relief. It's more of a prevention thing, and it will work over time. But if you need something like with COVID, you need to bring the inflammation down now. Yesterday, it had to be down. You put
Hmm.
that person in a hyperbaric chamber. Why they develop inflammation, why they're predisposed to that inflammation, that's another story. Those are lifestyle factors. Stress creates a lot of inflammation.
Mm.
When you over exercise, when you overdo it at the gym, it also creates inflammation. So, a lot of a good thing is not necessarily a good thing either. So, you need to carefully look at that. Lack of sleep. You know this feeling, you've slept 3 or 4 hours, you wake up the next day, and you just feel inflamed. You just like feel that you really just want to
Puffy and
sleep.
gross.
Yeah, absolutely.
Exhausted.
And grumpy.
Yeah. Hmm.
That's how you feel, and that's inflammation. We need to bring inflammation down, and we have a lot of tools. Things like supplements. Vitamin D brings inflammation down, especially in people who are deficient. Melatonin is
Mm.
great anti-inflammatory. Turmeric, you probably heard about that one. Turmeric, or also called curcumin, it's a great green tea, is great anti-inflammatory. So we have many tools in the box. Red light therapy is anti-inflammatory. We have many tools. We have, to know how to use them, put them together, and hyperbarics. And hyperbarics is great because in 1 hour you can achieve a lot, and it's non-invasive. It's not something, even an IV therapy that I really enjoy, but that kind of involves a needle going into a vein, and not everybody is
Hmm.
really too keen about that. But go inside a hyperbaric chamber is really easy. And it brings down inflammation, and that brings us to weight loss, because weight
Wait,
loss is an interesting one.
before you go on to weight loss, Carla, I want to hear about everything we just learned.
Yeah, I mean, it's interesting because it's the first time I'm hearing about hyperbaric treatment, and I want to know actually what are the side effects. If there's any side effect of that
I
treatment.
I mentioned claustrophobia because,
Okay.
as you could see, let me show the ones who were not, because we did. Let me see. How can I? Let me move around without. I think maybe that would. This is a hyperbaric chamber, so you get inside. In a first or second treatment, you might feel a little claustrophobic. You might not. I've had many patients who just went in and they absolutely had no claustrophobia, but because I have claustrophobia myself, maybe that's kind of, that I always talk about it. But
Mm.
it's absolutely manageable. Absolutely manageable. There are tips to avoid claustrophobia. It is quite spacious inside. Like I can actually sit up inside the chamber. That's how spacious it is. There's a lot of space. I get in with my daughter, and we take two dogs with us. So there's quite a lot of space.
Okay.
Other side effects could be discomfort in the ears because we're changing the pressure, right? So
Mm.
when you fly on the airplane, some people, when the plane goes up or the plane goes down, they might feel it in their ears. Solution, you need to equalize the pressure. So you either need to yawn or maybe open your mouth or just blow into your nose. Not an issue for many people. There are
Mm.
contraindications, which I should talk about. Very few, only one absolute contraindication, and that's a collapsed lung. So if a person has a collapsed lung, they're probably going to go to the hospital. They're not going to be
Mhm.
getting into a hyperbaric chamber anyways, but we must say that there is a contraindication. And there are some relative contraindications. For example, sinuses, inflamed sinuses, it would just be uncomfortable. Same with an ear infection, or maybe high fever,
Mm.
or uncontrolled high blood pressure. If a person comes to my clinic and their blood pressure is 180 over, I don't know, 100, I'm not going to put them in a hyperbaric chamber. We're going to work on their blood pressure. Generalized anxiety. just because a person can get anxious, but we'll just spend a little longer talking about it, and generally it's fine. There are a couple of others, but really they're just minor, and your hyperbaric practitioner would always go with you over the checklist to see if you
Mm.
might fall. Maybe a pregnant woman, if she hasn't used a hyperbaric chamber before. Here in Europe, not so much, because they're using hyperbarics for pregnant women. In US, being just a little more cautious with that. Not every hyperbaric practitioner would, want to put a pregnant woman in a hyperbaric chamber, but generally, if there are no, it's even used for pregnancy, for some of the complications of pregnancy.
So, okay, while we're talking about this, I know we're kind of focused on inflammation and weight loss and the hyperbaric chamber as like a little known secret that is really helpful. So, we're trying to put the word out there, obviously, because a lot of people don't know about this and it's really helpful. So, I guess my question is, what can you just run down a list of things that going into the hyperbaric chamber would be really useful for, just so people get an idea of how much?
Oh gosh, it's huge.
Mhm, mhm.
He said we're only going to be here for an hour. I don't know if I can finish in an hour. So, okay, it's being used for wellness. And I have a hyperbaric living podcast. So I interview all kinds of people, from doctors to patients to clinic owners. Um, about the cost of the therapy, I will go back to that because you're not the first one to ask that question. So I will
Good
cover the
question,
costs of
Tendai.
therapy. Let me just go over indications first. So it can be used for wellness, for just to feel better, have more energy. I use it to recover from my workouts. It improves sleep. It helps to deal with stress. It relaxes a person, works on a vagal nerve, and it relaxes the nervous system. So that's one area. Oh, sorry, I'm like confused with this. So that's one area, that's wellness. Professional athletes and amateur athletes use it, again, to have more energy, to heal from injuries. And that's the big one. You know how hyperbarics was discovered? They've learned that people who were building the bridges under the water, they were healing from anything so fast, and they looked a lot younger than other people their age.
Did you say they looked a lot younger?
Yes, because Kia, it's huge for anti-aging, because there's studies that show that it actually increases something telomere length. So that shows how old you
Mhm.
are. The shorter the telomeres, the older is your age. So it increases the telomere length. It's used for anti-aging.
But what's the
What
difference
else?
with red light therapy? Red light therapy also has the
Uh,
effects.
No, it's quite different effects. Let me
Okay.
finish with this, and I'll go into. I'll talk a little bit about red light. They can be used together. Okay, they're
Okay.
synergistic. So when you use two together, the effect is bigger. Red light is also used for injury recovery. It's used for neurological diseases, as I said, for recovery from strokes, children on autistic spectrum, cerebral palsy, all kinds of neuropathies, concussions, brain trauma, brain injuries, recovery from addiction, because your brain needs a lot of oxygen. When we
Mm.
set oxygen to the brain, it starts changing the course of the disease. What else? And I'm saying, just like it's also used in the hospitals for indications like the bends and carbon monoxide poisoning, healing from surgery, healing from radiation. It's used in cancer. Gosh, there's so many indications. Really, if you want to learn about indications, go to my website, and I write about indications for hyperbarics. It's huge. It's not a magic pill. Okay, let's make this clear. It doesn't cure every disease on the planet, but it does. Um, oh, somebody just canceled their Botox order. Good stuff.
He's not gonna do Botox because he's going to hyperbaric chamber.
Yes, yes. Let's do hyperbarics. Let's do hyperbarics. It's great for